my warmest welcome and sincere greetings to all distinguished guests and dental experts. We gathered here today to take part in this international symposium, a platform for academic exchanges and opportunity for us to develop to a high level, and it is also a moment for us to learn, discuss, share, and grow together. The purpose of this symposium is to promote the development of the field of stomatology, promote international exchanges, and jointly make greatly contributions to the cause of improving human health. We are very honored to have been able to invite 20 distinguished guests from the United States, the Philippines, Thailand, Indonesia, and Vietnam, as well as our Taiwanese dental experts here today. Your presence is not only a support for this symposium, but also is a very honored of Johnson Medical University. Therefore, I would like to express my most sincere gratitude and respect to all distinguished and guests and experts. In this era of globalization, international academic exchanges are becoming increasingly imperative. As professionals in oral medicine, we should contribute to learn and explore, keep in line with international standards, continuously improve our professional knowledge, and promote the development of oral dental medicine. We hope that through this symposium, we can strengthen exchanges with experts from the Philippines, Thailand, Indonesia, Vietnam, and other countries. Discuss the future of dentistry exchange, the latest research results, and the dental experience. Further expand our academic horizons and contribute the advancement and development of oral dental medicine. Thank you very much.
Thank you, Professor Chen Jinten, for the encouraging words. Next, I would like to invite Dean Maria Cristina, Dr. Ebes Solano, Dr. Maria Alicia from Manila Central University to share with us about patient-centered dentistry, the central venous driving force for IPC. Please welcome.
A pleasant good morning to the distinguished members of this Chung-Shan Medical University, headed by the President, Professor and President Huang, and to Dean Chen. Of course, to our beloved Professor Chia-Che Kao, who is the lead of this program for the new southbound special needs oral care, to the distinguished deans of the different universities in Southeast Asia, to the different representatives of the different universities, and of course, our participants attending Zoom. A pleasant good morning to everyone, friends and guests. So this morning, we are very fortunate to be invited again to present and share what is happening in our area, which is the Philippines. And fortunately, we are two representatives here in the Philippines. And the title that we will be focusing on is about patient-centered dentistry, the central venous driving force for interprofessional collaboration. So the presentation of Professor Wolf earlier was really inspiring. And the works that we have witnessed continue to motivate us to do better. And it's very timely that in the Philippines, the dental education is now implementing its new curriculum on its 5th year. And it's good that this interprofessional collaboration, interdisciplinary, are actually, and special needs are integrated in the curriculum. Now, our university, Manila Central University, is located in Caloocan City, that is north of Metro Manila, and it is highly urbanized city. Actually, we have a population density of 1 square kilometer per 30,000 people. That is how many the populations are. And as you would see here, on the left is actually the icon of our city. This is called the monument. And it is actually a representation of the proletarian works of the hero of the Philippines. We call him Andres Bonifacio. Now, it's very close to the monument, our university, which is founded in 1904. So that this year, we are celebrating our, next year, we will be celebrating our 120 years. Yes. Now, we have 3,400 plus population in our university, and we offer more than 15 programs with 10 colleges, including basic education. Next slide, please. Now, these are the programs. And the College of Dentistry is actually opened and operated since 1929. So that this year, we are commemorating our 94 years. Now, we also have a university hospital where trainings are being conducted, and several affiliated hospitals wherein this is part of the referral system of our patient needs oral health care. Now, for our presentation, we have several objectives. We would like to explain one of the thrusts of our university, which is on social learning and participation, how this is achieved through collaboration that we are doing, and that is part of our title. The second is to discuss how linkages provide opportunities and activities in the realization of our aspirations, our vision mission. And the third is we would like to share how patient-centered care enabled Centralinos, us, the faculty members, the students, even the alumni and friends who are supporting us to practice interprofessional collaboration. So I'll be turning the microphone to Dr. Edbert to continue the presentation. Thank you.
Thank you, Dean. Good morning, everyone. So I'll be tackling about the national context on how the special needs is being handled in the Philippines. So this is a recent study done in 2016, the National Disability Prevalence Survey, which stated that the Philippines has prevalence of at least among 15 years old, which is 12%, with a moderate disability, 47% with a mild disability, 22% with no disability, and of course, predominantly women are more susceptible for this disability. And furthermore, by age group bracket, the prevalence of severe disability is the highest among individuals with the oldest age group of 60 and older, and the least among is 15 years old to 39 years old of age. So this is the age distribution as well. The prevalence is a moderate to severe disability with the age, and 15 to 39 years old is with the lowest of 6%. And of course, the prevalence of the moderate disability among the age to 15 to 39 was at least 42%. And when it comes to the self-care aspect, which is the main focus of this study, tells us that about at least 10% with these persons have a disability rated looking for their health as an extremely to extremely problematic. Okay, so there's a problem on how they handle this self-care for this disability. Now, me as also a part of a government tertiary hospital, we have the PhilHealth, or the Philippine Health Insurance Corporation, which helps us to utilize the procedures which is under chairside or even general anesthesia and do it the same way. So I'll be calling Dr. Camacho to continue as well.
Okay, good morning, and good morning, Professor Cao, Dean Chen, Professor Yu, our vice presidents, all the deans, and the participants of this symposium. Okay, I hope that Professor Wolf is still around Zoom, because you inspire me, and I hope I can get in touch with you someday for consultation for the enhancement of our curriculum, especially on the management of patients with special needs. So our title is inspired by the thought that we would like to give holistic care to our patients. And that is why we encourage our students for social learning and participation. And Centralino is the name that we call each one of us. I am a Centralino, our students are Centralinos. And of course, the social learning and participation can be best achieved if we continuously develop our curriculum to include our dental public health and management of patients with special needs. But of course, we know that our students need more than the knowledge and skills that we share to them. It is the compassion and the heart and the empathy and the spirit of volunteerism that we need to inculcate to our students. That is why we came up with the group Katuwang. This is the outreach arm of MCU College of Dentistry. Katuwang means your partner in health, your partner in providing quality health. And our students can best achieve this if they participate in community programs. So years back, after my training here in Chungshan, under Professor Yu and the opportunity given to Professor Kao, our very first project, this is the implementation, pilot implementation that we have made in our community, a patient, a stroke patient, and since we are into interprofessional collaboration, we involve the different programs of Manila Central University. Of course, when I first saw the patient, the problem of seeing her condition, of course, as a dentist, I would like to give dentures right away. But I'm not happy about it. And for sure, my patient will not be happy about the denture when she cannot move around, even her hand, she cannot move. And I do not know the condition she's at when I went to the community. So at first, I don't know whom to call. Will it be the nurse? Will it be the doctor of medicine? Will it be the physical therapy? But looking at the condition of the patient on a wheelchair and cannot even move her hand, I decided I'll get the physical therapy. I'm not sure if I made the right decision, but at least I started to collaborate and everything follows because I was able to encourage the College of Medicine, the pharmacy, the nursing, medical technology, and optometry to assess the patient and for us to provide the holistic care. So, I would just like to share with you that the opportunity given to us by Chungshan Medical University have gone a long way already since we started in 2019 here. And sad because it was pandemic, but still we persevered until 2020. Dr. Ruel Briones, whom I am with when we had the training, we were the first trainers in Manila. It was in 2020. In 2021, Dr. Solano, because he was trained in 2020, became one of the trainers in 2021. And in 2022, we became 4. Me, Dr. Solano, Dr. Nang, and Dr. Briones. So that is how we would like to impart to the entire university the opportunity that we have gotten from CSMU. So, because I was inspired by the networking, so I believe that, of course, the opportunity came first from CSMU, and we maximize every opportunity. That is why we tried to reach out with the guidance of my dean and the support of the administration. We have expanded our services. We really did our best to become active in our adopted community, that is Barangay 143. I even talked to the daycare center teacher so that we will engage all the students and empower the parents and the teacher of the daycare students. I got in contact with Mercy Home for Girls, for the abandoned girls, and there are 39 in the Mercy Home for Girls, and we will be doing assessment. The minute I come back to the Philippines on Monday, I will be doing assessment at Mercy Home for Girls. And also, we partner with the church because we believe that the church is the center of the community and it has a great influence with the people in the community. And of course, Manila Health Department, so that our students will have the optimum experience and the expanded experience of serving the community. And of course, the center, this is where it all came about. This is where it all came from our partnership with CSMU. And of course, our MCU's future mission community, the Taiwan Fund for Children and Families that was introduced to us by CSMU. We had already our initial meeting, and we continuously communicate with them because we see a lot of opportunities of serving not only the community that surrounds our institution, but we can make our service known to other communities so that many will be covered by the services that we will be giving. And I am sure that Taiwan Fund for Children and Families will be a good partner for achieving that particular purpose. And of course, I'm proud to say that we have launched the satellite dental clinic in the community. It is in the heart of the community. So again, inspired by our referral system, so that people in the community will be able to have some place to go to when they have needs for their oral health care. And these are our partners taking picture with us during the launching of our satellite dental clinic. And these are my student leaders, the leaders of Katuwang, the outreach arm of the College of Dentistry. And this is the referral system that we had. And I am happy to say that because of the satellite clinic, we are slowly achieving the purpose of this referral system. Okay, so we had a memorandum of cooperation for special needs referral system, and these are the people involved in that referral system. And I'm happy to say that they know already where to go to because we have the satellite dental clinic. We attend to a patient with global development delay. And of course, as you notice, we explain it to the parent because as Professor Wolf has mentioned a while ago, it is very important that we empower the family and the caregivers. And this is during the procedure. And of course, we cater to our geriatric patients. And this patient, really, we had a difficult time because she had suffered stroke and the blood pressure is not going down. And yes, we really empower the patients because they do not know the value of maintenance medicine, and that is part of our advocacy in the community to really make them knowledgeable about their own health. So we were attending to her for 2 months already until we achieve a good result. And of course, for the MCU Oral Healthcare Unit, those procedures that we cannot do in the community because of limited resources, we cater to our university to give the optimum care. This is the work of our student. And of course, to maximize the the support that we can have from the other programs of MCU, we started collaborating also with the College of Physical Therapy. And so this is during one of our sessions with the College of Physical Therapy students, their teacher, and me. So this is our first collaboration with the students. That is what we do in the community, collaboration with College of Physical Therapy. and collaboration with the College of Nursing. And it's happy to note that our nurses, we would like to develop them as dental nurses also, because these nursing students have a good chance of working abroad as dental nurses. And they appreciate each other's work during the collaboration. So this is what we do in the community. The van, we're riding on a van because I'm inspired by Professor Yu. He carried us all the way to different home visits. So let's have a van and go to the community, okay? Okay. So we had a dream, we began to plan, we have grown, and we aspire to do more. Thank you.
Thank you, Dean and doctors, for such an insightful presentation, which consists of important messages and concepts in the emphasis of patients-driven care. Is it called Katuwang? Am I? Katuwang, yes. Okay. Following, we are delighted to have Dr. Angelo Maduli from Manila Central University to present the topic of humanizing oral health care for patients with special needs, an MCU commitment.
Good morning, distinguished guests and participants of this symposium. I am not a dentist to start with, but I hope in this sharing you will see how the Manila Central University is transforming our experience with the new southbound special needs oral care program. We are in a conceptual emergency, and humanity is losing its bearing. Clearly, humanity is dancing at the edge of chaos. As of March 16, 2023, the Philippine population is already at 113,646,000 plus. And if you will look at the Philippine Dental Association claim that they have 15 members nationwide, 48,000 are only inactive and serving as dentists to the country. Roughly estimating one dentist to service 53,000 patients, given the current population. Prior to pandemic, the healthcare system in the Philippines is fairly addressing basic provision. However, most of these health services are concentrated in the urban areas. Given our experience during the pandemic, several concerns and challenges came into the picture. So this is not a good data. Issue of equity, access, capacity, cost, and compensation came into the picture during the pandemic. And this became very, very challenging for all of us. But in the midst of all these challenges and pressure, we saw another concern. And this is very much emerging. The issue on disability. Like they shared a while ago, it's based on the Borjan project, and I quote, approximately 15% of the world's population experience a form of disability. And in the Philippines, about 12% of the population is somehow experiencing disability. This two is not a very good combination. Poverty and disability is considered double insults to humanity. There is an important need to revisit our position and understanding about persons with disability and their access to better health care. Furthermore, we need to identify the array of steps possible in further refining the humanistic dimensions of healthcare services. I started with a conceptual emergency because humanity is really losing its bearing by looking at the other people who are on the edge of need. When I joined Manila Central University 2 years ago, I discovered their partnership and collaboration with Chungshan Medical University, which gave me an inspiration and somehow gave me that encouragement to focus on promoting humanizing or humanization of health professionals, not only in dentistry, but other professions. I would like to express my special thanks to the people who work closely with us, especially Professor Cao, the project proponent of the new southbound special needs oral care resource and integration project under the Department of the Dentistry of Chungshan Medical University, for sharing this project with us. And as part of the Manila Central University's contribution in this international symposium, I would like to share 4 major tensions as described from several researches for which the Manila Central University is now in strengthening our resolve to further participate in this project. The first one is the tension on commodification versus being humanistic. We all know that private and public education institutions are equally confronted by this tension. The very core purpose and function were put to test when the concern for business survival is given the spotlight. Private professional practice of health professionals, such as dentists, is not spared from this concern. Actually, right now, we are having a hard time getting professional dentists to go into education. Another tension that we have is over biomedical and being humanistic. Too much emphasis on biomedical procedure or intervention and disregarding the social context of our patient, whether they are poor, disabled, underprivileged, vulnerable, what have you, may unfavorably affect the holistic diagnosis and care due to a patient. In a research done by Levesque and others in 2015, participants in the study expressed the same concern. According to them, their business is their mouth and teeth, not their social challenges. Another tension that we discovered is the individual bias versus being humanistic. Individuals are not free from any biases or stereotypes. Our implicit biases in certain contexts may occur and may affect the way we would like to engage our patients. As described in a research done by Narayan in 2019, implicit or unconscious bias is the tendency for people to harbor negative stereotypes or make judgment about another individual or group. In her study on nurses, nurses with implicit biases may demonstrate less compassion for their patients and invest less time and effort in therapeutic relationship, adversely affecting assessment and care. And the last tension I would like to share is over technification versus being humanistic. Almost similar to too much emphasis on biomedical, the focus here is on the techniques, technologies, and procedures that may be required. De La Fuente Martos and others in 2018 coined the word over-technification of care, resulting in depersonalization of care for patients. The process managing the disease became the very focus of the care activities, missing the fact that behind every patient's illness lies a human person. Considering the lesson learned from the different tensions and strong advocacy of the new Southbound Special Needs Oral Care Project, the Manila Central University cannot help but to strengthen our commitment to nurture not only the academic and professional competencies, but also the social competence of our students. Hence, you heard about our project Katuwang. Social learning and participation became the cornerstone of our next strategic trajectory on how we would like all our professionals to be nurtured. So as shared earlier, our SLP is strongly guided by the social constructivist learning principle, which focuses on collaborative nature of learning, strengthening the belief that an individual's behavior both influences and influenced by personal factors and social environment. Education can no longer stay within the walls of the university. We need to go out. Because for every professionals that we're going to produce, they will join a community. They need to understand the context of the community. They need to see diversity in the community. They need to see not only the privileged, but also the underprivileged. Not only the normal, but also with those extra normal needs. SLP is an integral component of our academic and professional preparation. It is strongly guided by this principle that we mentioned. So as mentioned in the project, this social constructivism emphasizes the importance of culture and context in understanding how all these things are appearing in a society and how our people in the community constructing their reality. We have a very simple dictum in every meeting that we are having in the Manila University. And I think some of my deans and academics are always using this now. When I said to them, language, Dean? Language creates reality. We have to be very careful with the choice of language that we are using. In the context of the student, they learn. They learn to rely on others to help create their building blocks for sensitivity and deeper awareness of others. Not to mention learning from others to construct their own knowledge and reality. With this framework of Katuwang and the social learning and participation principle, we believe that now SLP became the cornerstone of our holistic and transformative learning. Currently, we also encourage our postgraduate students to join in this Katuwang project. So it's no longer just a student-armed project for the community. It's now an integral part of their learning experience. We envision our dentistry students to truly benefit from this experience. As soon-to-be dentists and soon-to-be professionals, given their acquired competencies, their practice shall be significantly anchored in the community where they will share their talents, especially to those less privileged, marginalized, and vulnerable. Lastly, with our partner, with Chungshan Medical University, through the generosity of Prof. Kao and his team, we also would like to explore oral health care for patients with special needs as one of our dentistry subspecialization, an interprofessional or interdisciplinary initiative in giving our students a special exposure. Such specialization may add value to our students' basic degree and also in their practice. This move may redefine healthcare provision that may be required by a patient. Again, I believe we can do better. And I think the new southbound project is here to do better. We can do better to change our mindset first, to see normal from not normal, from able to disabled, from privilege to underprivileged, and to see special from non-special. Again, we need to change not only the practice, we need to change the mindset. Thank you so much and good morning.
Thank you, Dr. Angelo. Thank you, Dr. Angelo, for sharing such inspiring presentation with us, allowing us to understand better where the major tension lies in special care needs and how it is important to tackle them to deliver a humanistic dental health. Moving on, we have Dean Arturo de Leon from Our Lady of Fatima University today to talk on new era in special care dentistry. Please welcome Dean Arturo.
Yes. A pleasant morning to all of you, fellow leaders of the dental profession, academicians, and of course our big brother, Professor Kao, and of course the director for dental medicine of Chungshan Medical University. I would like to thank everyone for giving us the chance to be part of this noble endeavor in addressing or focusing our efforts to a special sector of our population. And on the onset, I would like to thank the previous presenters for making our lives easier and presenting the scenario in the Philippine setting of the of dental profession, dental education, and dental situation in general. So my purpose is just to present our paper, but more on putting on the table some of the recommendations that we think or we believe can improve our focus on this growing concerns on our dental profession. So please, next slide. Next slide, please. So this is just a slide depicting the history of Philippine dentistry and how it's being regulated. But unfortunately, we suffered as a profession some years back when the very agency that governs our affairs was, so we say, debunked by the Philippine government. The Bureau of Dental Service was removed from the operation of the dental Department of Health. So there is no specific agency in the government that takes care of the concern of the dental profession and the dental needs of the population in general. We are relegated under maternal care. While it may be a simple drawback, it became a stimulus for all of the academician practitioners to gather together and reinvent Philippine dentistry. As you might be aware of, Philippine dental education is based on the American dental education, which is odontological in nature. So slowly, we migrated from odontology to stomatology, which is, I think, more appropriate training grounds or platform to address what we're having right now. Stomatology, as we are aware of, produces physician dentists, which are very the ones needed to address this oral systemic correlation of the needs of our patients that we are now focusing on. Patients with special needs is a window of how they are doing with their total systemic health. And of course, the barometer of this one is their dental needs. As we address their dental needs, we can improve their health, total health, hoping that we improve man as man. Fortunately, we are now increasing in numbers, the dental colleges. We are now totaling 32. The 27 of which are members of full-fledged members of the Philippine Association of Dental Colleges. One thing good about this one is last few years ago we were able to gather our talents together to come up with a new curriculum for Philippine dental education. And one of the curricular enhancement is an introductory course to patients with special needs, management of patients with special needs. I think that should be the concept of these 6 countries that we're joining. Together with our PADC officers, one of the PADC officers, Dean Garcia, we would like to invite everyone to collaborate and let us harmonize our instructional design on special needs. Come to think of it, if we have 6 countries with standard subject instructional design on special needs, we will be developing a bigger, more cohesive wave of champions that will address this issue. So perhaps we can start it online. We'll gather, collect, and collate all the instructional design and come up with a standard instructional design for everyone and implement it on various population in Taiwan, Philippines, Indonesia, Thailand, and Vietnam. Next slide, please. Yeah, our very able Vice President talk about statistics on dental profession in the Philippines. Our problem is not only the ratio, it is the distribution. Our biggest problem is the distribution. When I was then the president of the Philippine Dental Association, high 8,000 practicing dentists are focused on urban area, Metro Manila, and the rest were scattered all over the other 2-3 islands. One thing that we really thought about this one is because dentistry is a very expensive education and profession. The ROI or return of investment is focused on the minds of the graduates. Initially, we cannot take it away from them. For them to be viable, they have to be financially rewarding. But now we realize that a lot of dentists now are subscribing to the real essence of the color of dentistry. We are not developing we should not be developing dentists who are not only proficient in their chosen field, but very much involved in the development of its community. Very much involved in engaging the members of the community as a dental professional. So we are having again a strong wave of campaign for dentists to look at dentistry not as a source of livelihood, but as a chance to help other people. And we always put it under the color that we wear. As you might be aware of, lilac is the universal color of dentistry. For us, it ceases to be just a color. For us, L-I-L-A-C, lilac means live it like a calling. It's not a job, it's not a career, but it's a calling that calls for everyone to serve other people. And with that focus, I think we can now invite other people to invest on other areas that might really need professional care. A lot of them. In a study that was shown in not necessarily in oral needs, special needs, but focusing on oral cancer, a lot of oral cancer patients are from rural areas because of the other risk factors that are present in their locality. Yes, it's the same as always. Next slide, please. We're also fortunate that the government is manning the Department of Health with equal number of practitioners. We have around 50,000 registered dentists, but only 18,000 are actively in the practice, and only 14,000 are renewing their professional identification cards. So we have equal numbers, but I think for it to be viable, the support group of the Department of Health should be at least quadruple than the professional care that we're providing. And I think we really need to drum up the support of the other professions. And I must commend the Centralinos in highlighting the essence of IPC, or interprofessional collaboration, making sure that the support group will always be there to support the primary professional care, which are the dentists. No? Next slide, please. When we talk about special needs as a subject, I would like to commend Professor Wolf for giving us the illustration of what we want to profess. No, we subscribe to the 3 M's: mission, man, and machine. No, he really explained it to us well. We know our mission. No, we know our mission that we need to make sure that everyone should be given the proper and relevant dental care. But do we have the manpower to have it? We would like to commend the initiative of Chungshan Medical University to plant the first few seeds of champions who will have not only the knowledge but the heart to push through with this kind of endeavor. We need to appreciate the fact that not everyone enjoys dental service. Oh, maybe that's the word needs, NEEDS. Not everyone enjoys dental service. No? For one reason or another, they might not have the access, or they might not have dental professional who is available for them. No? And I think that is one of the understanding that push us to modify our outreach program. In the Philippines, it's customary for us to do mass mission, dental mission, mass outreach program. But these are, while it's doing good, it might be impersonal and it leads us to violate some clinical procedures or principles. We are now highlighting the importance of home visitation. More individual, more personal, and the impact to the population is much greater, that if you cannot come to us, we will go to you. And I think that's the test of being a dental professional for other people. They say that service is inconveniencing oneself for the convenience of other people. If we can relate that to our students, I think we have already defined our mission. And the manpower development, I think, again, we are now learning from this sharing of best practices. No? What we can do now perhaps is come up with an electronic bulletin to capture everything and then translate it into a training program that may be applied for the 6 countries. And our ambition, no, we have 7 specialty associations in the Philippines. One of these is on public health. But we would like to learn from the experience of Taiwan that 1 out of 10 now is on special needs. So I would like to invite Dean Garcia and the rest of the MCU to let us band together and start an association for special needs. I think we have now populated the profession with people with working knowledge on special needs and with the heart of a volunteer to spark an organization, be the spearhead, no, and convert this concern into a specialty discipline of Philippine dentistry. Next slide, please. Next slide, please. There you are, no? As of now, it is the Philippine Pediatric Society that declares that they have the knowledge and the skills and the training to address special needs of the patient. No? However, we are all aware that all of this training acumen can be part of an organization specializing on special needs. Of course, we cannot call it special forces. Special forces for special needs, no? So we may be the Navy SEALs and the SAS of Philippine dentistry. Next slide, please. There you are, the Philippine Pediatric Dental Society. Maybe perhaps because they are on the front line of engagement of individuals with special needs. They are on the front line. They are the ones who engage these people. But that should not stop other discipline to come up with a multidisciplinary approach in addressing these special needs. And having a collaboration with other professions. In so many papers about the collaboration between dentistry and physical therapy, we came up with assistive devices in toothbrushing, no? Specified by a dentist and designed by a PT, physical therapist. So you can see the immediate and high impact collaboration between two professions. Next slide, please. If it can be part of the curriculum enhancement, we are hoping that it can be part of the board licensure examination. It may be coercive in nature, but that is one way of deepening their understanding, basic understanding of what special needs. If it will be part of the board examination, licensure examination for dentistry in the Philippines, the students and the faculty will value more of the academic side of it. But that can be a start of a more deepened valuation of something that is now relevant in today's world of the dental practice. Thank you. So, new era, nurturing educational wisdom that everyone requires assistance. That's the new era. Nurturing everyone's wisdom, educational wisdom, everyone requires assistance. If you're going to go out there and think that everyone needs assistance, no matter if you're healthy body, with a healthy body, or with disability, I think that should be that should empower you to extend yourself more. In the Philippines, of course, we are not happy to say this one, but when people with special needs will come to the dental clinic, the first option is to refer them. No, maybe because the dentist would like a better service for them, and perhaps they honestly believe that as of now they might not have the training or the capability or the logistics to address their issue. Our ambition is that in the near future, when an individual with a disability will come to us, we are ready. We are ready for them. And I think also the three M's, the mission, man, and machine, will be ready to accept people with disability or people with special needs. Yeah, good, thank you. The same, no? So I see, I told you, the first selection made by our presentation is here. So our hope is that the Board of Dentistry will now capture this subject and have it as part of what we call the boarded subjects, so that all the health education institution would so we say increase its focus on special needs, nurturing the seed, not the seed. Thank you. There you are, as a proof, no, management of patient with special needs. Actually, this is actually an offshoot of what we had in SIAD. In SIAD, when I was the president 2012, we all agree, 65 colleges, all of us, in Mahidol University, where we held the conference, we agreed that all of us should have a subject like that. If the 65 colleges can do it, maybe the 6 countries, or the colleges in 6 countries, can further improve this one. no, can highlight the focus on special needs. What do we need to teach our students? All of the universities participating in this very noble conference will have the same lesson plan, and therefore will have the same products, and the circle of champions will like a wave of nobility, no, increasing, ever increasing, ever mindful, ever serving humanity. Yeah, thank you. So as of now, pediatric dentistry, but I believe that it should be be more liberal to allow other disciplines to participate. Next slide. As of now, no, we have a zero special need dentistry center. And I think with the help of our big brother and all the people here, our ambition is to have that number at least to have 2-digit all over the country. Our, no less than our medical director is considering, the one you visited in Antipolo, to have a new department dedicated for special needs. I think it's a multidisciplinary and multi-professional department that one of the more excited departments were the Department of Rehabilitation Medicine and Department of Anesthesiology. And of course, surgery. No? And happy to note that dentistry might be the lead department on this one. So it's not just a center for treating people with special needs, but also boosting the confidence of other professionals around the center that we can co-manage it. No, you should not ambition to just to refer it to us. You should ambition to co-manage the patient with us. So that when you go out, you have now we will bring with you the experience and perhaps spread the good news. And again, gather more champions for special needs. Next slide, please. This is one of the more exciting legislation that I think we can now capitalize on. The government is implementing and harmonizing training, education with the profession, particularly on universal healthcare. No? So if we can interject special needs on this one, I think the entire scenario, the entire picture may be complete. Remember, not everyone enjoys dental service. So those people who are not enjoying it, let us pull them together towards us and embrace them like a true dental professional. With that note, I would like to introduce our Deputy Dean to talk about some of our projects in special needs in our small city of Valenzuela. Thank you very much.
Thank you, Dean Arturo, for sharing with us your knowledge, which is very relevant in these days. Indeed, emphasis in collaboration with other schools or professions are important. Moving on, we have Dr. Sharon Alvarez from Our Lady of Fatima here today to share with us her expertise. She will be touching on how dentistry is like in Philippines in terms of status, scope, challenges, and the future perspective. Please welcome.
To the University President, Professor Chen, Professor Cao, Professor Chuan, and to all the beloved deans here, and to our fellow academicians. Good morning to all of us. Okay, my name is Sharon Alvarez. I am the research coordinator and also the faculty member of our college. Here, what I will be presenting to you will be the preview, what special needs dentistry is all about in the Philippines, pertaining to the scope. So for the scope, in order for us to deliver the quality treatment to our special needs children, of course, we need to define the scope of that practice. As Dr. De Leon already gave us the preview of it, just like in other countries, the practice of special needs, it's integrated in pediatric dentistry. So what could be the problem when it happens? So because it is integrated in the practice of pediatric dentistry, very few professionals are into doing it. As you can see here, if it's only in pediatric dentistry, there are only 143 pediatric dentists in our country. So imagine, we are catering to the dental needs of children, adolescents also, infants, and plus the 1.4 million Filipinos who have special needs. So there is really poor ratio, poor dentist and special needs patient ratio in our country. Also, it looks very nice, what I presented here. These are the different institutions that would provide dental services to patients with special needs. There are tertiary public and private hospitals. Why tertiary public and private hospitals? Because in these hospitals, as well as some private dental clinics, these are the only places where we can see the specialists who can manage or who have the training to cater to their needs. And unfortunately, there are only few of these hospitals, and the distribution, mainly it's in the key cities in Philippines. And as you know, there are 7,100 islands in the Philippines. So imagine if it's only focused on certain cities, there will be a lot of patients with special needs who cannot get access to the quality dental treatment that they need and they deserve. So, what other challenges do we see now? So like what have been presented by Dean De Leon, as you can see, there's only 2 training centers for dentists. And both of them, they are located in Metro Manila. What's going to happen to those dentists who wants to get trained for special needs in far-flung areas like in Mindanao, wherein by plane you have to travel for an hour or so? So that's another big challenge for the practice of special needs dentistry in our country. And also, one of the challenges that we recognize in the practice of special needs, this is according to the Department of Health. It says, they recognize that oral disease is a serious public health problem in the Philippines. And this is for the entire population. It's not only specific for those who have special needs. Unfortunately, we don't have any data pertaining to the oral health status of those with special needs. Everything will be just anecdotal. Everything will be just arbitrary. Like me, I am practicing pediatric dentistry, and I know 96% of Filipino children, they have dental caries. So much more for those who cannot have the dexterity to clean their mouths. Those are those patients with special needs. So I hope we can start with this one. From the perspective of a researcher, we should have a definite data that will establish oral health status of this vulnerable group, the special needs patient. And what is good about the Department of Health? Yes, they have the program when it comes to the oral health. However, look at this. When it comes to the objective, it is for the general population. There's no specific program for the special needs patient. And targeted is their approach also. They have the program for pregnant women, also for infants and newborns, school children, adults, adolescents. However, there's none for people with special needs. So I think the best start is with that one. The government should have or should devote the time, the effort to come up with the oral health status data for special needs patients. Okay, another challenge that I will be presenting to you will be this, when it comes to the cost. There are many barriers when it comes to the access or the availment of dental services by patients with special need. It can be personal factor. As you know, those people with special need, they tend to stay home. One is maybe because of the stigma. Number 2 is fear of the dentist, of course. And there are lots of other factors. Even the motivation coming from the parents, that can be a problem. Or for adults with special needs, their motivation coming from themselves and also the caregivers. The support that they get from the caregiver, that really dictates their availment of dental services. But one of the factors that I want to highlight is the low family income of most Filipinos. I'm not romanticizing poverty in the Philippines, but that is really the reality. A lot of people, the income status is really poor. So instead of going to the dentist and availing dental services, of course, they would just save it for other needs, like their food on the table every day. So that is a major challenge. Now, you might be asking me, what about the support coming from the government? Yes, we have PhilHealth. And it has been mentioned earlier that, this is the national insurance system in the Philippines. But when it comes to dental services, only surgical procedures are being shouldered by this insurance system. However, some people, they have the private insurance system, the HMO. But then again, I will repeat, most Filipinos, they live in poverty. So how can they avail those HMOs? So you see the big loophole when it comes to the financial aspect of getting the treatment. Okay. And I guess for me, that is the major barrier that we are facing right now. So what lies in the ahead in the future? When it comes to the financial aspect, we are really looking forward into this. In year 2019, our very famous president then, everybody knows him, right? Yeah, he's really famous. So President Duterte, he signed the Universal Healthcare Act, and now it's a law. What the law says, everybody should have the access, to the healthcare facility services, and they must be protected against financial risk. Until now, they are drafting the specific when it comes to the dental treatment. We are praying, we are hoping really hard that there might be some reform or changes when it comes to the financial aspect of getting the dental treatment with this law, the Universal Healthcare Law. So, from our perspective, being part of the academe, what can we do? We know that those are the limitations, but I guess we can start our little steps. So, in our perspective, in our university, in our community or public health dentistry, we had a program. We are now drafting a program wherein we will be starting in a small community. But we are very much careful in doing that. We are taking little steps. Why? Because remember, we are dealing with vulnerable population. So there is ethics that we have to consider really hard, and that ethics will be the one that will be protecting them. We must assure volunteerism among, those patients. Also, we are respecting their autonomy. And also, when we do community programs, we are assessing the risk and the benefits to the participants. So that is our limitation. But our adapted community is in here. It's very close to our university. That is a small community called Santa Brigida. But now, little by little, we are incorporating the nearby areas in Valenzuela. I will be showing you later. So what we can do now, since financing and logistics will be our problem, we have to mobilize everything. We need to exert effort to involve the local government of Valenzuela. So here, because of this collaboration, then we can improve our facilities for those people, the manpower, the equipment, and as well as the other tactical support that we can get. And I want to highlight this. The city government, they have 2 dental buses. Inside it, there are dental units, 1 or 2 dental units. And this one is capable of being equipped with more, like an aesthetic unit, if needed. one of the barriers that I didn't showed earlier is the access. You know that for those who are capable, those people with special needs who are capable of paying for dental treatment, they'd rather go to the private dental clinics, right? But then again, there's only few of them. So what's going to happen to those who cannot avail it? We cannot, we are inviting them to our university, to the dental clinic. However, because of some constraints, they might not be able to do it. Even their mobility is a problem, right? So if they cannot come to us, might as well use this technology so that we can go to their community. So this is the dental bus that we are eyeing. We are contemplating on equipping and bringing into the community. The partnership of our university is with the government as well as with the Chungshan University. So in the community, we have the medical institutions that can provide us the facilities, right? So our hospital, our dental clinic, and the Valenzuela Medical Center. Because what we want to provide those people with special needs are the lasting and the appropriate treatment for them. So we want to provide the comprehensive dental services to the recipients. So, yeah. Yeah. So these are the administrators who are working hard in order for us to have this project come into reality. And we are tapping on this, the interdisciplinary approach to managing those patients. So, like me, I am heading the pediatric dentistry department, and there's also Dr. Liel Plantig, who is in community dentistry, and then two will be heading the oral surgery section. And we will be working under our big boss, that is our dean. Yeah. Here, yeah. Yeah. So Chongshan Medical University can probably give us the big help in this aspect. You started to inspire us to start, the special needs dentistry in our country. That is, I guess, one of the area that we have neglected for a long time. Yes, I'm treating some patients with special needs, but from the perspective of those who cannot avail, that is what is missing and lacking. And that is what really we want to work into. And in that partnership with the local government unit, we started, immersing our students. But again, we are very careful in, sending our students and having them treat those with special needs. Because we have to remember, our students, they still don't have the license to practice dentistry. So they must work under our supervision. And when it comes to special needs patient, only those with license and proper training, we will be tapping into the program. Okay, so this is when we visited the local government unit for the possible partnership. Okay, this is the consultation. We consulted, we started, the development of the program plan for special needs. We started with seeing what is present in the community, what can we offer, and what the local government unit can provide us. So basically, that is part of the needs assessment that we are doing right now. And then, we surveyed the community. So this is Santa Brida. This is the community that we are serving right now. But we identified, those people with special needs who needs our care. There are 266 households in this community. And as of this date, we identified 22 people with disability and with dental or oral care, problems. So the home visitation at this point will be just to assess their need. There. So you see, when we interview them, one of the barriers that they have, First is the stigma. You know, in our country, when you have the special needs or when you have the disability, they have that stigma. And they don't want to go out. They don't want to participate. They just want to stay at home. So we need to inform them. We need to let them know what lies ahead of them. And yeah, they have oral needs. Most of them, they have dental pain that they used to bear. In all of those interviews that we did, for the 22 patients, all of them, they have dental pain at some point of their life. So when we ask them, what do you do when you have, or when your child has oral pain? They would just say, I'll give paracetamol. When we ask, did you bother to go to the dentist? No, because there's no dentist available in the area. Okay. That would cater for their need, of course. So how is it like in Valenzuela or in the Philippines? For public health dentists, there is 1 or 2 public health dentists per barangay or community. But you know what the services that they offer? It's only extraction, unfortunately. So people in the academe or people from specialty groups, we need to step up and we need to step out of our institution. So we need to reach out to them. We need them, and they need us also. Okay. Now here, this is another partner institution that we have. This is Bahay Kanlungan. It's a very good shelter because here they have at least about 22 house parents. House parents are those caregivers. And there are 86 patients here. What they call them is clients. Yeah. So among those 86 clients, about majority of them, they are mobile. Okay? 1 is bedridden, and the rest would need a little bit of assistance. Now, when we ask them, if they have some oral concerns, what do they do? There's no resident dentist in that facility. So what they do is they refer the patient to barangay or to the barangay dental clinic. But then again, I would be reiterating, in the barangay dental clinic, what they offer only will be extraction. So everything that they will be doing for those patients with special needs will be just palliative treatment only. Okay? What we envision is, as we tie up with them, we want to provide comprehensive oral management that is sustainable. I was talking to the dean. I told the dean, maybe we can start training the house helpers or the house parents, because maybe they don't know how to manage and they don't know how to take good care of those teeth. So how do we start? Start with the research again. That is our promise, yeah. And then there's another institution, which is Valenzuela Education Center. This is a learning institution that caters to those people with or children with special needs. Yeah, we would partner with them also. So with that, you see now how it is in the Philippines. The special needs dentistry is in its early stage. Yeah, together with the MCU, maybe we can start. We can start a new beginning for special needs dentistry. And we are looking forward to that. And when you invite us again next time, maybe we can present something, a new development for this aspect. Thank you very much.
Thank you, Dr. Sharon, for sharing with us, for us to understand better the challenges faced in Philippine special needs, as well as the vision in the reforming dental services to overcome these barriers. Now, we will take a break for 5 minutes.